kids today are different. And I think anybody who sees kids can know that. I mean, adults are different. We're seeing massive changes all over the place. There are some deep biological differences, and these are some of the reasons. These rising rates of ADHD, autism, anxiety, and depression, it's globally happening, not to mention chronic metabolic diseases. We never used to see, it used to be called, adult onset diabetes. Then we had to change the name and call it type 2 because it was happening in kids. There was, so lifestyle diseases are happening to 6-year-olds now. There's a big change. We're seeing things such as earlier hormone collapse. I see teenagers come in all the time with no ability to make things like progesterone, thyroid disorders, diabetes from obesity. Here is something that doesn't get discussed very much, is the damage that's happening to the brains in development that are happening from toxins people are talking about. Dare I say, I speak a lot about vaccines and the damage that they do, and the vaccine coupled with the Tylenol, what that is doing to a child in that process. Non-native EMFs, Wi-Fi, and 3G, 4G, 5G, what is happening with radio frequencies and microwaves and non-native EMFs, very, very profound on the mitochondrial function, which is hugely a big part of mental health. Nutrient depletion and dehydration that those are causing, and then therefore causes the body to be able to make no charge. The brain is a battery, and if it dehydrates from these things, you can't hold charge, and the children can't ever, restore themselves. The severe lack of movement, being allowed to go outside. So by the new culture of being in the house, no freedom of movement, no freedom of exploration, no sunshine, no outdoors, and what they have been given then is a screen. Screens in and of themselves, and nobody wants to know about this, the damage it is doing to the brain in and of itself is one of the most shocking things in neurodevelopment you can do. It is as dangerous to me at this point as a vaccine. And there's books and resources and all these things, and that could be a 5, 6, 7 hour lecture just on what it's doing to a child neurologically, hardwiring them to give you the signs and symptoms and have the brainwave arousal of attention deficit or anxiety and dyslexia as well, because you are hardwiring the function of their brain from that screen and their interaction with it. Plus, it is removing the face-to-face vagal connection that they're supposed to be having with their mother. So now you have two people that are often dissociated, and that child no longer knows how to connect, no longer knows how to make eye contact, no longer gets all the micro expressions and information, the subtle cues, and the mirror neurons don't get the safety signal of knowing how to behave and connecting and bonding with mother. So then we have these longer term dissociative or behavioral or personality disorders that look like, attachment disorders now in children that we never saw before. It's simply because face-to-face contact has been replaced with a screen.